Well, welcome everyone. Thank you for coming today. We have a great set of alumni panelists here to share their experience with you all and answer questions on the topic of healthcare administration and management. As we go through this presentations, feel free to type your answers, or excuse me, your questions in the chat, or use the raise hand feature and we'll call on you individually. We'll start by asking each of the alumni to give a brief, about 3 to 5 minute overview of their career path and their current role, and then we'll open up the floor for questions. So we'll start in alphabetical order by last name. So Bonnie, if you want to go first.
Hi, everyone. Great to be here today. I'm Bonnie Eweld, she, her pronouns. I am an associate director of our Center for Health and Social Care Integration at Rush University Medical Center, which is in Chicago. I'll talk a little bit more about that work a little bit later, but big picture, I graduated from UW in 2011. I did a double major in math and geography, and I minored in gender and women's studies, or I got a certificate, I should say, in gender and women's studies, and kind of had a organic development to my path to get into my current role, kind of following my interests and kind of building on skill set. But I would say when I graduated from undergrad, I didn't necessarily know that I wanted to be working in healthcare administration. So kind of high level, what I've been spending the last 10 years since getting my BS doing was I moved down to Chicago afterwards. I did a year of AmeriCorps service, which I highly, highly recommend for folks who are looking for hands-on work and learning experience, and also who are kind of have the service and community health kind of mindset in mind. There's a lot of really great opportunities to be embedded. I was embedded in a community health center on the west side of Chicago, but there's a lot of different AmeriCorps roles. We have AmeriCorps members at Rush, at the hospital where I work at now, as one example. So I did that work for a year, working directly with patients, providing health education. And one of the many things I learned that year about myself was that working directly with patients wasn't the best fit for me for a number of reasons, but that I loved working in healthcare. And because I had this experience embedded in a clinic, I got to see how many behind the scenes roles it took to make a clinic run and to make things as effective and as efficient as possible. This was all also happening as the Affordable Care Act was, kind of slowly the policies were being implemented over time. So it was just kind of really good timing. Then briefly after AmeriCorps, I went for 3 years to work at a health policy nonprofit based here in Illinois, where I did a lot of kind of behind the scenes work as like an action-oriented think tank, which I'm happy to answer more questions about that work, that collaborated with a lot of hospitals, community-based organizations, and also did policy advocacy around Medicaid and some other health policy issues. And in that work, I started collaborating with Rush and the team that I now work with. And so since 2016, I've been staff at Rush. I do behind the scenes work, so it is a healthcare administration role, but I work kind of with a public health lens. I do a lot of external trainings, and we provide technical assistance around integrating social workers and community health workers into healthcare teams, trying to get this work paid for. So looking at reimbursement opportunities with Medicare and Medicaid, best practices, how do you document about these kinds of interventions in the electronic health record. I do grant writing to get these types of services paid for. Some policy advocacy. I ended up going and getting my master's in public policy. So related to advancing all of that work, I've helped our team operationalize our COVID community response, and we're contracting with the city and now have a team of 30 people doing contact tracing and testing and vaccination outreach work in the community. So I guess I tried to paint that my role has meandered a little bit, but I think it's really neat how diverse healthcare administration roles can be and how there's a lot of ways to kind of build on your passions and skill sets. So I'll stop there, but look forward to being with the panelists and answering any questions throughout the rest of the hour today.
Thank you so much, Bonnie. Ben, if you want to go next.
Sure. Good afternoon, everyone. My name is Ben Jarvis. I'll give a little bit of background. Grew up in rural northern Wisconsin. Attended UW for my undergraduate between 2002 and 2007. Graduated with a bachelor's degree in medical microbiology and immunology and biology. I'm not sure MMI is offered anymore as an undergrad, but it was then. And when I graduated, I wasn't exactly sure what I wanted to do either. I think probably around 80% or so of those undergraduate majors in MM&I go on to some sort of medical professional school, but that was not my path. I ended up working for Becton Dickinson, which is a laboratory company in Madison, and they made petri dishes and agar dishes to test for bacterial infections and others. And I was placed there by a staffing agency, and kind of quickly realized that just that lab work was so different than my undergraduate coursework, when you can kind of go to the terrace and have a beer and finish your lab reports and things like that. That's not the real world. And so I realized, like I said, quickly that wasn't for me. And then the staffing agency that placed me there actually hired me internally. And so I kind of out of nowhere, not science related, worked as a recruiter for a year or two, and then got into sales and business development for them, kind of selling their services to the biotech companies on the west side, which was great for a while until it turned into pretty much cold calls. And that's not what I was looking for. I really wanted to get back into science and healthcare, which was my passion. And so I literally came home. I think I Googled one night, science, healthcare, and business, and then realized that healthcare administration was a legit career that is all over the place. And so did my due diligence, had to take the GMAT, and started applying to CAMI accredited graduate schools around the country. At the time, there were no CAMI accredited healthcare management schools in the state of Wisconsin. There are now. And so I was fortunate to get into Rush, Bonnie. So I spent 2 years getting my master's in health systems management at Rush University in Chicago. And then after that, and I got to work there, you had to work as you were going through that program. So I worked for Rush Health and the Office of Transformation down there while they were building their new tower, which was just a great time to be at Rush. Very fortunate for that timing. After that, I was fortunate to land a administrative fellowship, which are optional for Rush graduates. And there's probably, maybe 100, 150 of them around the country. And there's probably around 2,000 or 2,500 graduates. Not all of them obviously look for a fellowship, but it's a great path into healthcare management and healthcare leadership. And so I landed a fellowship at North Shore University Health System, which is at the time was a 4-hospital and medical group system based out of Evanston, Illinois. So one of the closest suburbs on the north side of Chicago. And so I completed that fellowship in a year, and out of that transitioned into a clinical manager role. And so I managed in orthopedics for 2 years, which was as a first, I guess, kind of real healthcare management job, was definitely drinking from the fire hose. They had just acquired the Northwestern Orthopedic Institute. So they had transitioned maybe about a dozen or close to 20 physicians and advanced practitioners from the private Northwestern-based practice to the suburb North Shore practice and an employed model. And so they were the doctors for the Chicago Bears and the Blackhawks and USA Soccer. And so very kind of high pressure, high demand physicians to work with. And so at that age, it was, like I said, kind of drinking from the fire hose about learning about healthcare operations and frontline operations. But it was perfect for me. I really enjoyed it. I got married along the way, and my wife is a Badger. And so even though she was from Evanston, we decided to quote unquote settle down back in Wisconsin. So about 6.5 years ago, moved back to Madison, which I love. And so I am currently sitting at St. Mary's Hospital right now. My first position here was as a clinical manager for Dean Medical Group, which was acquired by SSM Health out of St. Louis right before I came back. And I worked as a clinical manager for a couple of years for urology and plastic and cosmetic surgery in our procedure suites. And then after a couple of years, took a promotional opportunity to be the director of musculoskeletal services. and did that for 1 or 2 years until just about a year or so ago, a year and a half ago, in March of 2020. I was redeployed to the incident command operations for SSM Health for our COVID response. And so I did that here in Madison for 3 months. And then during that time, SSM had a restructure that they undertook, eliminated the director roles, including mine, which was an interesting time, but posted a number of positions as clinical program administrators. And so my position kind of got combined with surgical operations. And so now I'm a clinical program administrator for musculoskeletal services and the surgical clinical program. And so currently I oversee about a dozen departments in the Madison market. Musculoskeletal includes orthopedics, hand and upper extremity, podiatry, and sports medicine. And then in the surgical clinical program, general and pediatric surgery, ENT, audiology, oral surgery, plastics and cosmetics, and urology and pain management. And so I have direct responsibility for those, 5 clinical managers on my team that run those operations in the Madison market. And then I guess horizontal or matrix leadership for the state of Wisconsin for the SSM medical groups, and then some system roles with our musculoskeletal team leading some of our activities at a system level. SSM Health has hospitals and clinics in 4 states, Oklahoma, Missouri, Illinois, and Wisconsin. And so I dabble in all of that. So kind of a classic evil healthcare administrator, if you will, with a pretty classic path from undergrad, graduate school, fellowship, and then entry-level management, director role, and then an administrator role. I didn't kind of map it out like that. It kind of just happened. I only applied for 1 or 2 jobs along the way, and you kind of just get tapped. As I think the healthcare industry, people say it's kind of getting older as baby boomers age, but the reality is that leaves us, and I still consider myself an early careerist, as the younger folks that are kind of filling those roles as those individuals kind of get towards that retirement age. So day to day responsible for operations, like I said, Madison. So nurses, medical assistants, schedulers, those folks report to the managers, and then up through me. Physicians, APs, they have a parallel reporting structure through other physicians, and those are our dyads. So we lead in a kind of a dyad structure, a physician, a surgeon in my case, in the general surgery clinical program, and then the musculoskeletal clinical program, and I lead the operations. And so they kind of, we do it all together at the hospital and in the clinics. And so I can kind of pause there and come back to answer any questions. Thank you.
Great, thank you, Ben. Marissa, you're up next.
Hi, I'm excited to be here today, so thank you. My name is Marissa Sandcooler. My story isn't quite as long as Ben's and Bonnie's. I just graduated in the spring of 2020, so I am new into the field. I'm currently a graduate student at the University of Minnesota. I'm in my 2nd year, so Ben mentioned administrative fellowships. I am in the thick of applying for those right now and looking to get going in my career. From UW, I graduated with a degree in psychology and then certificates in business and global health. Over this past summer, I had the opportunity to do an extensive internship at a federally qualified health center. And this is something that really interests me, is promoting access to underserved communities, promoting primary and preventative care to enhance population health down the line, and then also just focusing on the patient experience across the continuum of care. So I do not have a huge long history, but I do have experience with graduate school and things of that sort. So that's kind of where I'm at in my career at this phase.
Thank you, Marissa. It's nice to have kind of both ends of the spectrum of someone maybe still in school and a couple of folks who are out of school, just different perspectives to bring to the table. So as a reminder for students here, feel free to put your questions in the chat or raise your hand and we'll call on you directly to ask those, as well as if you feel comfortable putting your year in school and maybe your major in the chat, just so the alumni have a little bit of context about kind of where students are coming from. So does anyone have any questions right off the bat? If not, I have, yeah, Aiden, go ahead.
You guys hear me? Awesome. So what the biggest question I had so far, really for more for Ben and Bonnie at this point, but I do have questions for Marissa as well. In your day-to-day, where sort of, because I hear in healthcare administration, it's kind of like a middle ground between like business management and like medicine. Is that true? First and foremost, kind of somewhere in that. Okay, we're getting like a sort of maybe. I guess then sort of where on the spectrum of like that does that fall for you? Like in your day to day, do you feel like you take more similar roles to like a doctor, physician, or do you take more of a similar role to like a CEO of a company? And I don't know if you can expand on that, but that was my question. If yeah.
Bonnie, you can go first if you want.
Sure. I would say, I guess if I had to choose between those, like closer to CEO of the company, although certainly I'm nowhere near that, but almost like CEO of the specific programs and projects that I work on. So, kind of doing whatever it takes to make a certain program vision happen. I do a lot of grant funded projects. So, I mentioned coming up with, okay, how are we, like, what's the workforce who's going to do this? What's the protocol they're going to follow? How are we going to get referrals? What patient population is eligible? Like, what training materials do we need for our physicians and our nurses and our social workers in order to be able to do this? Like, someone has to be kind of coming up with all of those materials and making all of those decisions. And so that's what I, as a program manager, do. And so that would be more of, I think, a common healthcare administrator role. I'm a little bit less traditional of an administrator than I think Ben is, in terms of I don't do like clinic management. I do more of like public health program management that's based under a hospital. So my role, I think, is a little bit less traditional in that sense. However, healthcare is increasingly getting more and more expansive in how like healthcare entities in general are engaging in this world of social care, like responding to social determinants of health, and connecting with in-home services that we know are really important for people to be able to be healthy in their homes. And so, like, who's developing those organizational partnerships? Sure, maybe individual physicians have contacts at those organizations, but building things from a more structural approach, and creating the formal agreements between organizations, coming up with how are we going to share data, how are we going to know if our initiative was successful, how are we going to know if we're saving money so that we can sustain this long term. Like, all of those things I think typically would fall under kind of a healthcare administrator's role.
I agree with everything Bonnie said, and kudos, Bonnie. I know that Rush leads that, and the field undoubtedly needs more of it. So kudos to you and the things that Rush are doing, because we need more of it, and it's definitely going that direction. And I would say my answer is very similar, Aiden, is that I'm the last person that you would want touching a patient. Medical microbiology and immunology is great, but it's more of a lab. You would not want me in an exam room or in an OR. That is for sure. Although I've cleaned rooms, I've turned them over, I've checked patients in, I've made the phone calls. I can't touch anybody. That would go south real quick. And so yes, it's definitely much more on the business side, and I leave the real work of touching the patients and treating the patients to the professionals that do that. I would say that the main three things that the managers do is they run operations. Are the lights on? Are the computers working? Do the people that are doing that important work have the tools and resources they need to successfully care for and treat the members of our community? And then we facilitate the physician and clinicians' practices. So developing the programs, making sure the staffing is appropriate, and things are going well. And then we manage others, right? We have to be a leader for others. And so we have direct reports that are providing the care, rooming the patients, cleaning the rooms, answering the phone calls. And so, managing the physicians' practices, managing the operations of the business, and then having direct reports and leading others is more of that traditional, if you will, healthcare manager role, not, I guess, touching the patient or providing the care. I think that was your question. So,
thank you so much.
Right, and we have a couple of questions in the chat as well. So we'll start with Amanda's question. She's curious to hear more about what a typical day looks like in the field, which kind of builds off of Aiden's question, either for your job or maybe past internships that you've had.
I suppose I'll start on this one. So they're long days these days. Healthcare delivery has been always a wild ride, but in March of last year through now, it is a forest fire, if you will. It's sometimes feels like controlled chaos. I'm not going to lie. Between staffing shortages, high census of the hospital, increasing demands on diverse programming, like Bonnie's alluded to, telehealth needing to be established or expanded within days, not years, as the glacial speed of healthcare has done in the past. That's no longer an option. And so the days start early and sometimes they go long. So today started with an incident command type meeting at 7:15 or so. We have lots of surgical meetings at 6:30 and 7 a.m. because between the hours of about 7 and 4 p.m., you need your care providers to be providing the care. And so if you're taking them out of the OR, out of the clinic, out of the care provision setting, you're kind of wasting their time, if you will. And so we have meetings early with the surgeons. We plan a day. We have daily escalation huddles for events that occur, safety, quality, staffing, resource concerns. We triage all those through a tiered escalation process. So huddles at 9 a.m. and then 1 p.m. And then throughout the day, I spent a lot of time in meetings, and it used to be in-person meetings, and now it's a whole lot of time at this desk on Microsoft Teams or Zoom, discussing a lot of the things that are day-to-day sensitive, and that is, again, staffing, physical resources, supplies. It's changed, and it's a little bit different than it was during the heart of the pandemic, if you will, back to quote-unquote normal operations. But in the Madison community, right now in Dane County, our hospitals are full. It's not just St. Mary's, Meriter, UW. We are trying not to go on diversion. We're a level 2 trauma center. So we're talking about elective cases, where they can go. Do we send them up to Baraboo, down to Janesville? How do we do that day to day? And so the more fun stuff, though, is some of the stuff Bonnie was talking about, and that is the program growth and development. How do we expand our service offerings? How do we bring new services to the communities that we serve? How do we grow our patient volumes and grow our access, especially for underserved communities and underserved populations in high need areas? And so it's a huge variety day to day. It's very interesting. That's why I love it. But the day in the life changes day to day and week to week. But that's a glimpse of it.
Yeah, and I'll just quickly add, for me, it's also a lot of meetings. Like I mentioned, I don't do the kind of clinic level operations, so I have less of some of those meetings that been described, or those kind of tasks that been described. But I have, HR type stuff I have to deal with. I have 6 direct reports to me, but then about 40 people who kind of, with what we call a dotted line, are connected with me. And so there's weighing in on, like, making sure we have coverage for all of our projects, but also like what kinds of trainings do we need for our team members if people are out on leave, or we have people who are technically full-time but they're going to school, so how do we juggle things? So there's like that level of decisions. And then I do a lot of writing, both for trying to seek funding from like grant writing, and also writing blogs, and trying to at least get academic publications about our work. And so that takes a lot of time, as you all know. I'm sure you're kind of in the thick of writing for different classes. And so, being able to kind of concisely describe these on the ground programs and kind of make a compelling case, that takes time. So I spend time doing that. Yeah, so one other example, like this afternoon, I have a meeting with an ambulatory care network, which is basically a group called Oak Street Health that serves a bunch of primary care clinics in a couple dozen states that serve Medicare beneficiaries. So they serve older adults exclusively. We've trained them for the last couple of years to have structure for their social work teams, which has been a really cool project. So sometimes I do the trainings and webinars with them, but I'm also working with them on an evaluation plan so they can kind of study what their teams have been doing. And this afternoon, we have a meeting to kind of pitch our evaluation proposal to them. So like, that's just another example. Like Ben said, what the typical day looks like evolves every day. And so I really like the work because I'm always learning, I'm always meeting new people, but then there is some like continuity too. So it's not that I always know for like 100% what I'm doing. There's always a learning curve, but I feel like I'm grounded enough. So it's kind of a nice balance between those things.
Marissa, do you have any insight you'd like to share with folks about like what a day-to-day looks like for you while you're in grad school?
Yeah, I guess the first year of grad school is a lot more curriculum intensive than the second year. I think almost every day I was in class all day last year, just because they're trying to get you as much foundational knowledge as possible prior to your internship in the summer between the first and the second years. It is a lot of hard work, but it's doable. And being with a cohort of people really helps a lot. People are really supportive of one another. I guess now, because I'm in administrative or applying for administrative fellowships, life is a lot different. Our classes are a little less intense right now, and we have a few less than we typically do because the program wants to be able to support us through applying for postgraduate positions. And I think this week and last week have been very different than the rest of the year, with just a lot of interviews, a lot of applications, and it's just a stressful time that everyone goes throughout the program if you do choose to do an administrative fellowship. But I've heard the second year after you have postgraduate employment is a lot easier, and just the professors like are happy that you're there, happy to be able to help in any way that they can. So it is a lot of schooling, a lot of homework, but it's well worth it in the end, I would say.
Thank you for sharing that. So we have another question directed towards you, Marissa, but Bonnie and Ben, if you guys have additional insights, that'd be great. So can you tell us more about your experience majoring in a not business field and getting into graduate programs, excuse me, and do you recommend doing a certificate in business?
Yeah, so I'll start off by saying that in my grad school program, there are people from all different backgrounds. There are so many people who were planning on applying to med school and decided that they didn't want to do that. So they're like neurobio majors or biology or really any sort of science. And then there are people who majored in finance. And then I majored in psychology and had minors, which helped me to get like a wider breadth of knowledge. But I don't think it's necessary whatsoever to do a business course. I think a lot of them helped me with foundational knowledge, but healthcare administration programs know that everyone coming in isn't going to have the same background, and they really provide those foundational courses within the schoolwork in grad school to be able to learn those skills and take them forward. I think, yeah, the business certificate was helpful. I don't think it's necessary. If there's a couple classes in the business school that really interest you, I'd recommend taking them as electives because I think that's helpful just to have going in. But yeah, there's people of all different backgrounds in my program, and it's really nice too because the classes that I take are all very different from one another. So there's some people who have majored in business and you know that they're really good at finance or accounting. So they'll really help everyone out during that point. Whereas there's other people, like with my global health certificate, I was able to help people out in population health. And there's just very different differences in people's backgrounds, but you all end up coming out with the same knowledge and you'll all be able to be successful in the field no matter what you do during undergrad.
I would just kind of echo that. I would say if you're interested and want to, pursue a business certificate, great. But like I'm an example of, I mentioned I studied math and geography. And then I just have like learned on the job from different like online modules. I've done some Coursera stuff, going to conferences and like, intensive one-day training kind of things. And then I think when I was like 5 years post undergrad is when I went back to get a master's in public policy studies, which, was a lot of kind of quantitative analysis focus and really built on kind of the logic from my math degree. But I think you you can learn as you go. And like Marissa said, you're never going to be doing this work in a vacuum. So you'll always have colleagues and a lot of resources out there to kind of, figure out what you need to do well in school, if going to graduate school is on your radar, or to do well in a job.
Yeah, I can echo that too. My undergraduate majors, MM&I biology. I took very, very few business classes. However, there's a great comment in there from Zoe talking about some of the requirements, maybe not necessarily a business certificate requirement, although in retrospect, I wish I would have, because I think that's valuable whether or not you go into health management or not. But yeah, probably not required. However, like Zoe's comment says, there are a number of coursework or a number of classes that would be required for specific MHA or graduate type programs. Those are some good examples in there: finance, accounting, stats. I remember that I did not take an accounting class in undergrad, so I had to, the summer that I was applying, complete an accounting class. I took the course over at MATC, and some programs require certain graduate testing. So I took the GMAT. Typically the GMAT or the GRE are required for specific programs. Not all master's programs, but I think your typical health administration programs would require one of the two, along with some specific coursework. But the undergraduate degree is definitely all over the place, just like Marissa was saying there. History, biology, pre-med, it was everywhere in my cohort too at Rush, which was great, because then you have that variety of knowledge and backgrounds in your cohort, which made it super valuable. But definitely something to think through if you're considering applying. My only other recommendation is if you are considering it in the 5 years after you graduate undergrad, try to take that GMAT or GRE right away. I think I had to go back 3 years later and take the GMAT, and man, it's crazy how quickly you forget some of that stuff. So I think I took some sort of like Princeton review prep class, and I think I took the GMAT twice, ended up getting a pretty good score to get me into a Rush. But if you think you're going to do that, even if you don't know if you're going to do it right away, I think your scores are good for like 5 years. So maybe consider taking that GMAT or GRE when you're an undergrad senior, because that knowledge disappears quicker than you think. Maybe that's just me, but just a comment.
I totally echo that advice.
Yeah.
Just do it soon.
That's great advice. Thank you. And Marissa saying that Accounting 300 is a great class to take for programs that require it. And you don't need to be enrolled in the business school or the certificate program to take that course. So that's a nice little tidbit of knowledge. All right. So a question that I have for all of the alumni is, what are or were your most important considerations when choosing a job or a fellowship?
I can start with this one because I am in the process right now. I did come to grad school straight from undergrad, and I had some really great experiences in undergrad, but none of them were in a direct healthcare setting. So something that I'm looking to gain from a fellowship is a lot of them have rotations where you can really travel to every department within the health system and be able to learn what all the people in all of those departments do. And this is something that I really want exposure to be able to see what all goes into supporting the delivery of healthcare. Because I think this is something really important, and to be able to be a high level leader, I think it's important to understand everything that happens to be able to make those types of decisions later in your career. I think another thing that I'm really looking forward, hopefully, to about a fellowship is to be able to gain insight on high level leadership. As a fellow, you are basically sitting at an extra member of the executive team for some executive team or VP level at some places. And you get to see all of these high level decisions being made and how these really intelligent leaders think about things and lead their teams, and see how this plays into the mission, vision, strategy of organizations. And I think this is really helpful just as a learning experience for future leaders to be able to see how these things are talked about and how decisions are made at that level, because that's something you wouldn't be seeing until way later in your career otherwise, until you worked your way up that ladder. So that's something that's really important for me, just being able to understand the system better and to kind of work on my own leadership skills while observing other people and how the way that they lead.
You're prepared for your interviews, it sounds like, Marissa. No, I echo all that, and it's a good time to dabble, right? And to make mistakes and be forgiven, because you blink and you're in your mid-30s, and then the mistakes hurt a lot more. So then you're asking for forgiveness rather than being gifted to it when you're an intern, a fellow, and trying to find your way. So I think Marissa's answer was very good, and I think it's a good way to try to get breadth over depth, right? So you get to have a broad spectrum of possibilities when you're in those types of roles and looking at those types of roles, and you get to pivot if it's not something you're interested in before you're locked into that first kind of a longer term position, if you will. So I was preached that when I was a fellow, that breadth over depth is very valuable, and you have that opportunity in some of those early careerist roles, internships, fellowships, etc. And so those make them invaluable in that sense.
I think I'll just add that, this was would be the case no matter what sort of sector you're wanting to work in, but doing informational interviews with potential job sites or in the interview itself, trying to learn about the workplace culture, what are the hours, what's the in-person versus working remote, who would I report to, would I have direct reports under me, down to logistics of what kinds of training benefits would I get? What are the paid time off, PTO policies? Just learning upfront about all of that. It took me, I guess, a couple jobs to fully recognize that all that stuff, you want to get as much clarity on that upfront so you can have the info you need to make the best decision for you, but also in a lot of, again, not just in healthcare administration, but just in jobs in general, it's up to us to sort of make our own boundaries and say what we need as professionals and as people in order to be successful in our jobs, but also in order to be healthy and have time and mental space for our family or other things in life as well. And that's one thing that I learned, is that especially if you're doing kind of work where you are more in the service realm, or just really in any high demand work where you feel like you could always be giving and giving and going, no one else is going to tell you okay, you need to stop and step back. And so if you have a boss or a workplace that is supportive of when you do kind of say, you know what, actually I can't take that on right now, could we come up with a plan to make sure that gets done, but while recognizing that I've already been putting in a little bit of overtime this week. Having a supportive environment for those kinds of things is really key for long-term sustainability in a role. But I also just want to say I love the kind of focusing first on breadth versus depth comment, especially in the first several years out of undergrad. I think that's really important.
That's great insight. Thank you all for answering that question. Amanda, I see your hand raised. If you want to go ahead and ask your question.
Yeah, thank you. Can you guys hear me? Okay, sorry, I'm in Union South, so it's a little bit loud. But so I'm a senior and I'm currently applying to MHA programs, but I'm also considering trying to get an entry-level job and just getting some experience first before going straight to grad school. So I'm curious to hear what kind of entry-level positions you think would give good insight into what someone in healthcare administration would actually do, if that makes sense.
For me, it was really helpful to actually be doing more direct service, but being based in a clinic. So I got that experience as an AmeriCorps member, which is a year-long service learning program. I was embedded in a primary care clinic providing diabetes self-management education and those sorts of supports for patients and families. But I was in the clinic, seated at the nurse's station, kind of getting pulled into rooms. I I got to look at the clinic schedule in the electronic health record. And I mentioned, not until spending 40 hours a week doing that did I really understand how much behind the scenes legwork it takes to carry out that care day in and day out. And so for me, that was a really helpful learning experience. Certainly, I would imagine there's a lot of other kind of entry-level positions that aren't necessarily direct service focused, but I do think having some direct service experience, like that was 10 years ago that I was doing that, and I still draw on some of those learnings from the direct patient interactions, even though I haven't done it since. I've been behind the scenes since. So I think it both gave me insight into what healthcare administrators do and kind of the diverse roles, but it also gave me insight into like some of the like patient and family priorities that, always kind of need to be like the true north for care to be as effective as it can be.
Marissa, did you work at all, or did you go right undergrad to graduate?
I went straight from undergrad to graduate school.
Okay. In that case, I'll take a stab at the answer, and that is, so I worked in a laboratory, and then as a recruiter, and then as a salesman, I guess, a business development person. So there's no wrong answer, is my opinion. I think Bonnie has probably the best approach, and I agree with that. If I could have done it over, I would have done a more, frontline, service-oriented in the clinic or in the hospital, in the healthcare delivery setting, to learn the workflows and learn what it takes to kind of run those clinics and take care of those patients, right? And so anything like that, though, is a good answer, Amanda, because you can always relate it, whether it's direct healthcare or not, to what you want to do, and that might guide maybe where you apply, whether it's standard administration or public health or health policy. I mean, I think that all of those experiences over the course of a year or so might give you some direction on what you want to do, but they can all be used to build your kind of portfolio, build your resume, and help guide you and give you that real world experience that you're going to need. And it just really bolsters an interview process and an application. And so I think my cohort had the gamut. So we had individuals like Marissa who came right from undergrad, and then we had folks with JDs and legal degrees that were coming back 10 years later, nurses. I know Aiden asked a question about that care delivery versus that business person. And, some of the most valuable people leading healthcare organizations are both, right? That's the truth is that individuals with RNs, individuals with MDs or MPHs or NP type degrees that are also business savvy, whether that's a formal graduate degree like an MBA, or MHA, HSM, whatever, those are even more rare and very, very well versed to lead healthcare organizations. So I think any of those types of positions would serve you well, Amanda.
Awesome, thank you.
I also just want to add, even if it's not a job, there's a lot of like part-time volunteer type roles that you can also complement with other jobs.
Would you maybe want to expand on that, and like what types of volunteering might you suggest for individuals who are hoping to apply to these types of programs?
Yeah, there's like so many, and I would say it depends on your interest. Just like in my domain of kind of integrating social care with healthcare, I mentioned we have AmeriCorps members who are like full-time volunteers who get stipends, but we also have part-time volunteers who, like, one example is we've done this is the direct service type volunteering, so is less exposure to health administration itself, but at least kind of getting your feet wet in some of this work. Is we've had volunteers making like friendly visiting weekly phone calls to check in with socially isolated older adults and do like well-being checks, and also kind of make conversation with people. So it's a really like low intensity, easy to do from home example where the volunteers are asking some like structured screening questions for data collection. And so there's some, like inputting those responses into surveys. There's some understanding of like, well, what is important to the older adults I'm talking with? What kind of concerns are they experiencing in their daily lives? Like, again, that example is a little bit less exposure to like clinic operations and stuff like that, but just one thing that comes to mind, but so many opportunities. I've also had people do essentially like volunteer, like part-time internships, especially over the summer, that are just like 20 hours, 10 or 20 hours a week for 4 weeks. And that's like, we come up with a project together based on their interests. And it's not like super formal, but it's a way for them to kind of get their feet wet with some of the content and have built in time to ask questions to me about like what they're seeing. So that's my response. Ben, I don't know what you would add.
Yeah, I just say that, especially in the Madison market, I know for a fact that SSM Health and UW Health have formalized volunteer services departments that have actually kind of formal processes where you apply to be a volunteer a little bit because of the number of students we have in our community that are looking to go on to, whether it's healthcare administration or management type roles, but a lot of folks that are applying to medical schools, PA schools, nursing programs. They also are trying to kind of round out their experiences, resumes, and things like that to bolster their applications to the professional program. So I'm pretty confident that UW Health and SSM and very likely Merit or GHC, they have formalized volunteer services departments that would have a lot of great resources to take a peek into what options are available in that realm.
Marissa, anything you'd like to add about volunteering?
I guess just based on my experiences, I think one of the most important things when you're volunteering or looking for opportunities is to do something that you're passionate about. There's a lot of skills that you can gain within different jobs, internships, and volunteering that are transferable to the healthcare administration world. I know there's a lot of things that I did while I was on campus that it wasn't directly healthcare administration experience, but it was something that really helped me both in preparing for grad school and in interviews for grad school, just to be able to say, I use my leadership skills in this way in the setting that I had in my internship, and I can bring these same leadership skills to the healthcare industry to do it in this way. So I think it's really helpful just mostly to do something you're passionate about, have something that you really care about, and be able to gain those transferable skills that you can use in any industry and be able to speak on them.
Great, thank you all. And as Mike just put in the chat, just a little bit of a time check. We have a little bit over 10 minutes left. So students, if you have any lingering questions, we want to make sure you have the opportunity to ask alumni directly. So feel free again to raise your hand or put them in the chat. I'll just give a moment for pause.
While people are thinking, I think another thing that you can do that's not formal volunteering, but is just another way to kind of learn and get the gears going around types of roles you might want to play is like ask loved ones in your life, especially older adults, or if anyone has chronic illnesses or disabilities, so engages with healthcare a lot, like what has their experience been like? What have they enjoyed, or like what's been successful or what has worked well when they've accessed care? What has been frustrating? What has their experience been like getting insurance coverage for the care that they need, getting referrals to different types of providers? The system is not easy to navigate for any of us, even those of us who work in this world. And so I think just kind of learning from hearing directly from individuals about their experience can help at least you understand some of those challenges. And again, as future healthcare administrators, we're all kind of touching on those challenges and trying to make those a little bit smoother. So that's just another way kind of in the short term to understand a little bit more what the landscape is like.
Great, thank you for that addition, Bonnie. So I think we have time for about one more question. So after listening to all of you speaking today, what is one step or action that students listening can do today to start or continue their journey in healthcare administration and management?
Suppose I'll offer to start building a network. Healthcare leadership and healthcare in general ends up being a smaller world than any of us would think as you go through your early careers. LinkedIn's a great resource. Informal reach outs and trying to develop those relationships early on will always go a long ways to serve you well if you maintain them and kind of cultivate them, if you will, as cheesy as that sounds. Relationships are very important. And as I'm sure Marissa's learning, and Bonnie, I'm sure would agree, is that healthcare leadership is often a person-to-person interaction in a lot of senses, even if it's virtual. Relationships, building bridges, you have to do that stuff to drive some results, whether it's program growth and development or improving the quality of care that's being delivered in a given setting. So relationships are some of the most important things in healthcare, and so starting them early and trying to build those bridges and build that network is always a good idea. Participating in things like today.
I would echo that completely. I know I didn't even make a LinkedIn until the end of my senior year of college, and I regret that completely. I think even if it wasn't fully robust or fully built out, I wish I would have had that earlier in my college career, just because I met people and connected with them at that moment, but never followed through with that. And I think there are a few missed mentorship opportunities that I probably had in my undergrad because I didn't feel comfortable like connecting with them immediately and being able to follow up on those conversations. So that's something that definitely is really useful. In addition, I think it's important just to be knowledgeable about the healthcare industry, know what's going on. I know I'm subscribed to a few different newsletters like Modern Healthcare or Becker's Healthcare Review. Those are two that I really love to genuinely read every day and see what's going on in the healthcare world. And I know there's a ton of events on campus too, either through, I know within this, like the School of Medicine and Public Health sometimes has campus-wide events, and just being able to immerse yourself in the field as much as possible. And it really helps you to tell, like, if you get excited about these things, then you know it's the right career path for you also, which is something that has been really helpful to me as I can nerd out about things. I'm like, oh, I am in the right field after all. So it's just really reassuring to be able to stay updated, know what's going on, and just be aware of the field that you're going into. I think that's something that I've really appreciated and enjoyed over the past few years.
I love that. Yeah, and there's a lot of podcasts too, so it can be like passive, and I think that's really important. And that's just an example of kind of taking initiative. And the networking is an example too of like, it's up to you. And if you're proactive and responsive and show that you're passionate and committed to learning or following through on something, the folks who you're connecting with will want to keep engaging or working with you. So kind of leveraging any professional contact as an opportunity for potentially, down the line working more together. Kind of thinking through that lens is important. I'd also add, if you are thinking about or someday think you'll be going back to school, if you're going to kind of work for a while, is maintain connections with professors and other faculty members from UW. I did that for like 2 years after undergrad, and then I sort of stopped taking initiative and following through on those communications. And then when it came to applying to grad school a few years later, it was a little, you need letters of references, and I was able to get them from all my professional contacts, but it would have been nice to be able to get one professor who, could kind of speak genuinely to how I was as a student when I was in undergrad. That's it.
That's all great information. Thank you so much. Put a plug in for Success Works on the networking aspect. We have a bunch of online resources, which Mike linked in the chat, as well as we have additional alumni panels throughout the rest of the semester and additional programs for networking as well. So feel free to check out our website. And not seeing any additional questions in the chat, I think we can let you all go a couple minutes early. Alumni, thank you so much for being here today. I'm sure students gained so much insight into the field, and your words were very valuable. So thank you very much.